Hello, good evening, everyone. Am I audible?
Good evening.
Hello, good evening, everyone. Am I audible?
Yes.
Okay, so I am Dr. Shaista Bilal. Today we will give you a small presentation about how to prepare for MRCOG Part 1 exam. So all of you are ready?
Yes.
Okay, so today my topic is how we will prepare for MRCOG Part 1. So all of you know the MRCOG exam. There are three parts, part 1, part 2 and part 3. Part 1 and part 2, they are written exam and part 3 is the oral exam. So let's start our presentation now. Today in our presentation, what we will discuss today is how to prepare for part 1 exam and what are the prerequisites before the preparation, how to prepare for part 1, why do students fail, and how to make it in one go. So first of all, I will say that why to prepare for MRCOG exam. Because this is a very prestigious degree and your competency level will get increased. So let me tell you that when I was preparing for MRCOG exam, I myself just it make a huge difference in my clinical practice. Though you pass or you don't pass the exam, but when you really study for the exam, it will reflect in your clinical practice and your patient satisfaction level is increased a lot. And it will increase your learning and competency. And it is leadership in medical education, and it's a degree which is recognized globally and which is a very high credibility. And let's see that what are the prerequisites for the part 1 exam. Hello, Maham. Can you hear me? Hi, Zoni.
Yes.
So are you preparing for part 1 exam?
अभी preparation start करनी है हमने.
Okay, that's great. So what do you know about how to, what are the prerequisites? Do you have any idea?
Yes, eligibility देनी होती है हम लोगों ने और हमें सबसे पहले अकाउंट बनाना होता है, eligibility देनी होती है और उसके बाद हमने जो है वो अप्लाई करना होता है उसके लिए.
You are right. So what we will do, you just write in the Google that RCOG website, and here there will be an eligibility criteria. And once the exam date is announced, then you will fill the form. There are 2 attempts in a year. One is in January and one is in the February. And I will show you the details how you will enter. You will create an RCOG account. If you have already account, don't make a new account. Just register from that previous account. And when you will compose an email with the subject Part 1 eligibility assessment application. And then they will scan photo of your original primary medical degree certificate, a scan photo of your medical registration. All of us who have done MBBS and who want to pursue in gynecology and obstetrics, they are eligible for MRCOG Part 1. And this is the email address. You can send your application on this link. This is the eligibility application form. You can fill this form, and this is after this, when this form is prepared, just attach your medical certificate and then mail to the RCOG. This is the fee structure. You have to say that which band country you are. Like in Pakistan, India, most of us, we lie on the band 2, band B, which the fee structure is £555. This is the latest fees of 2024. And for January exam, these are the important dates. This is the eligibility deadline date is Friday, 6 September 2024. And then expression of interest closed on will close on Friday, 20 September 2024. Booking windows will be open on Tuesday, 29, 2024. You will book your exam date on this date. Then booking window will close on Tuesday, 17, and exam result will be on Wednesday, 19 February 2025. So these are the exam dates, important dates for the coming exam of the January 2025. Then let's discuss how to prepare for the Part 1 exam. That seems to be quite difficult. Like all of us, we are now in clinical practice, most of us. And again, we have to start from the very basics, and it seems very difficult to study the basics like anatomy, physiology, embryology, biochemistry. But believe me, it's not difficult. It is a doable exam. Just you have to just focus on your study, and just it needs a bit of hard work and consistency. And it's a doable exam, and I hope all of you can do it. These are the modules. The exam, it is of two parts. Part 1, A paper and B paper. This I will tell you later on. These are the modules. Module 1 is about anatomy and embryology. Module 2 is about physiology. Module 3 is about biochemistry. Module 4 is endocrinology. Module 5, epidemiology. Then 6 is about genetics, pharmacology, microbiology, immunology, biophysics, pathology, clinical management, and data interpretation. It seems like the topics are difficult, but when we will study, I will give you some brief explanation how to cover these topics. It's not that difficult. These are the distribution of questions from like anatomy from anatomy. This blue color shows how much percentage of questions will come from anatomy, the biochemistry, embryology, but the weightage is different about each topic. From like it doesn't mean that one question from anatomy and one question from genetics, they carry equal marks. Sometimes one question from genetics, maybe it have more weightage than one question from anatomy. So we have to prepare all the topics. Don't leave any module. This is distribution of question for paper 2, which include biophysics, clinical management, data interpretation, immunology, microbiology, pathology, and pharmacology. So up till now, anyone have any questions?
No.
Hello, Maham, Kanwal, any question? Hello?
No, not yet. I'm getting it.
Okay, that's great. So now I will tell you how to prepare, what is the exam format. It is a computer-based exam. The language is English, and there are 2 papers of 100 single best answer. And the first you have to do the paper 1, then there will be a break of like 1 hour, and then the paper 2 you will give. The exam format, each paper counts for the same number of marks. It's paper 1 counts for 50% of overall marks, and paper 2 also counts for 50% of overall marks. No minimum score required for each paper, and the outcome is determined only by candidates overall. Means combined mark. It doesn't mean that if you are not able to pass the paper 1 and you pass the paper 2, you won't pass the whole exam. No, the overall marks should be passing marks, and there are no negative marking. It means you should attempt all the questions. Don't keep any question. So this is the pattern of the paper. We have paper 1 and paper 2. Duration of the paper is 2.5 hours and 100 by single answers. Then there is a lunch break, and duration of the second paper is also 2.5 hours, and the number of questions are single best answers. And please take a break, take some coffee and like some snacks, so that you will be well prepared for the second paper. This is this example of a Pearson exam center where you will do your exam. And now we will go the module wise how to prepare for the anatomy. The paper pattern is like passing marks. You see, passing marks will be dependent upon the percentage. This is not the exact how much minimum you will get. The maximum number, like more, if more students get more, this is a like they will pass the upper 20 or 30%. Sometimes it is variable, sometimes 60, sometimes 70, sometimes 80. It means it's a competition. If you will go do good, the other will not attempt the good paper, you will have more marks, you will pass. So it is a type of competition. There is no single any deadline that what is the percentage of passing. Get it?
Yes.
Okay.
Yes.
So now we will see that what we have to study for the exam in for the anatomy module. Now you see you don't need to study for whole the anatomy from head to toe. You should be more focused regarding like which is ops and gynae related, like pelvis, perineum, brain, and abdomen, because some cancers there is metastasis to other body organs like lymphatic system, blood vascular supply, liver. You have to study whole the abdomen, pelvis, perineum, and brain, because brain, our pituitary gland is there, and endocrinology, mostly it came from there. So most of the, sometimes the exam pattern is they will give you some diagrams, and sometimes there is blood supply, nerve supply, and pelvic muscles, sport of the uterus. And these things you have to study more, and this should be more clinically oriented. And the next thing is embryology. Embryology also more should be focused on female reproductive tract and pharyngeal arches, cardiovascular system development, urinary tract, like major fetal anomalies also you should know that, because when you know the basics of embryology, that how it develops, only then we can study more. And in the microbiology also you should study like there will be some pictures, some percentages, some clinical diagnoses and treatments. And immunology also, you should study some hypersensitivity reactions, autoimmune diseases. It should be like, as I have told you, more should be clinically, which is related to ops and gynae. And later in our, when we will start our course, we will give you a more detailed explanation how to study and what are the modules and which books we need to study more. In biochemistry, I think everyone, who liked biochemistry during their school, medical school life? Anyone? Who was interested in biochemistry?
No,
No
not
one.
at all.
That's But believe me, you don't need to study whole the biochemistry now. Only just like urea cycle. Some enzymes are more important. What are the fat soluble? What are not fat soluble? And what will be the deficiency with the enzymes? And some carbohydrate, protein, and lipid metabolism. Only these major things. You don't need to study whole the Krebs cycle and all these things again. And pharmacology also should be basically we need to know the mode of action of many medicines. Mostly the contraceptive medications are very important. You need to know what is the mechanism of action and when to start, OCPs, when to start. And if emergency contraception pills, how do they work? What is the percentage of efficacy? And if you are taking any oral contraceptive pill and if you forgot the pill, what you will do? So basic things you should know. The contraception is very important. So you should, the contraception should be on your fingertips. And other medication, like what are the medication which are contraindicated during breastfeeding, during pregnancy, what will be their effects on the fetus? So these things you should remember. Like for example, a patient is on a carbimazole for it's an anti-thyroid drug. So how you will follow? This is very important because carbimazole, it causes neutropenia, and the patient will present with sore throat. So this some basic things, and the major side effects of these drugs you should remember on your fingertips. You need not to remember whole the pharmacology, only the important related to obstetrics and gynecology. Same like pathology, the cancers are very important. The staging of the cancers and the treatment, basic things what you study in MBBS, and some postgraduate level, that how the cancers and the metastasize, how from lymphatics, from basic things you should know. And other pathology like molar disease, basic things you should know about. And the general pathology. Same is like physiology. Physiology is a very vast subject and it's very important also. It carries a lot of, it have a lot of questions from physiology also. And also you should know about female reproductive system. Endocrinology is very important in physiology. And physiologically changes during pregnancy, the male reproductive system, fetal physiology, all of these things physiology, you should be more grip on physiology. Then endocrinology, it's very important. The most important hormones are thyroid gland, adrenal, pancreas, PCOS, thalamus, hypothalamus, and placental structure and function. You see the endocrinology, what you can do, you can make a diagram of how the patient will look with hypothyroid, how the patient will look with hyperthyroid, the adrenal, like Turner syndrome. These things, if you will make a picture and just remember that from head to toe, what will be the abnormalities with these glands, what hormonal changes will be there, what physical changes will be there. So you will remember. So there will be some diagrams, some infograms, or anything can come from endocrinology like this. So any question up till now?
You are going very well, very elaborative and very informative.
Thank you so much. If in between you want to ask any question, you can stop me and ask me. Okay?
Sure.
The next thing is genetics. The genetics also, basically we should know what are the autosomal recessive and autosomal dominant, what are the X-linked conditions, and how to counsel the patients. So these things are very important. So don't be afraid of genetics. It's not that difficult. The next thing is biophysics. Biophysics, it includes ultrasound, X-ray, CT, MRI, ECG, and electrocautery. Believe me, all of these things are very easy. They are what we are all doing these things in our clinical practice. Ultrasound, they will ask you what are the frequency of transvaginal scan, abdominal scan, X-ray, CT, MRI, in what conditions you will do, for ovarian cancer, if CA-125 is high, and when you calculate risk of malignancy index, RMI, so what you will do if it is less than 200, more than 200, so CT, so like these things also they can ask. And what are the radiation safe during pregnancy? What will be the side effects of if a person has an X-ray during pregnancy? So how it will affect the fetus? And same like ECG and laser, and same like electrocautery, it is very important. Sometimes electrocautery questions, there is a module in our part 3 exam. So if you know the basics of electrocautery now, it will be very easy to proceed with the part 3 exam when it will come. So it's not difficult. When you will study now, it will be very beneficial for you in part 3 exam. Now, what is the data interpretation? Data interpretation, what they will give you? They will give you some CBC like values, and then you will interpret that, or like patient with a GTM. You should remember what are the NICE guideline criteria for glucose tolerance test. I myself remember it very easily, like 5.5678. I remember like this. 5.6 is fasting, and 7.8 is after 2 hours. So just make some in your mind, what are things you can remember. What is the HbA1c criteria when you will start insulin to the patient with GDM. And CTG, you should know the recent guideline, NICE guideline of the CTG. What are the amber? What are the red criteria? What is abnormal CTG? What is suspicious CTG? So you should all know. Infertility assessment, WHO criteria of semen analysis, you should remember by your heart. What is the morphology, normal form morphology? What is normal sperm count per ml, and what is per ejaculate? So everything you should know in detail. And same like hormone level, they can give you some TSH levels. They will give you always some normal value also. So you don't need to remember what is the TSH normal range sometimes, because every lab criteria has the different, but you should know how to interpret the result. This is very important. And all these things all related with the clinical interpretation of the patient. So is it okay? I think it's not that difficult.
Yes, okay.
Now, statistics. I think everyone is scared of statistics, but trust me, it's also not that difficult. You don't need to go in detail of statistics. Just know the basic points like what is the sensitivity, specificity, what are the type 1 and type 2 errors, what is false negative, what is false positive, and these are the things, how to calculate the incidence, prevalence, basic things. Not go in detail. It's not that difficult. It looks scary, but trust me, it's not that difficult. These were all the modules and how you will study. These are the books which will be helpful during your preparation. You can just go through these books. These are very good books. And now I will tell you that how to pass the exam in first attempt. First of thing, just you have to motivate yourself that you need to pass the exam. Just schedule your timing. I know most of us, we are very busy in our life. Most of us, they are doing some clinical practice, or they are busy with kids, with daily routine. Some are doing double jobs. But if you want to prepare and want to pass the exam, just you need to make a schedule. For part 1, just I think 3 hours per day, it's enough. For part 2 and part 3, you need to study more. But for part 1 exam, 3 hours per day for a period of 2 to 3 months is very enough. And if you take a course, it will be very helpful. Try to take a course and study daily at least 3 hours per day. It will be very helpful. And prioritize your time management. Like if you plan to study in these 3 hours, just focus on these 3 hours and try to study on these 3 hours. Don't say, I will go there, I will do shopping, I will visit this family and I will study tomorrow. No, this is not the way. And one important questions you need to study for multiple times. And you need to do discussions. Discussion means you have to make a study partner. When you make a study partner, it will be very helpful. Means if you study alone, you will forget. But when you two are there, you have to match your timings and you have to study together. And stay motivated, you will pass, inshallah. And practice every day. Now I will tell you that why students fail for the part 1 exam. Because there are some mindset issues, there are some family tensions, problems, non-focused preparation. They think that exam is very easy and they will just study superficially, not in details, and they go for the exam. No, when you are preparing for the exam, you should give your full preparation. And there is definitely exam stress and sometimes examination strategy. Now I will give you some tips and tricks for the exam. You have to revise everything, not leave a single module. Try to cover all the modules and revise them. Make your notes. When you will make your notes and you will revise them, definitely it will be very helpful. And important questions you need to practice multiple times, like daily or after every week. Important questions, they should be on your fingertips. And you need to do practice how to do confused questions. Any questions? Hello?
There are single specific book to study.
You see from here, I have mentioned here some books. They are very good books. Mostly this Richa Saxena, Oxford. This is Catherine Anderson, Andrew Caesar. And all these books, they are very good. And important things I forgot, last 3 to 5 years recall questions. Like MRCOG part 1, we have 2 exams in a year, like Jan and July. So last 3 years, there will be 6 papers. So try to solve all these questions. Because almost 50 to 60% of the paper, it comes from the recalls. Any other question?
What's the passing percentage?
I think you have joined late. I have already mentioned there is no exact a definite passing percent because it is variable. If the students, they do very good in the exam, the passing percentage will definitely be high. If the paper is difficult and the guys, they don't attempt it well, so the percentage will be less. It depends. Sometimes 65, sometimes 70, sometimes 75. So it depends upon the difficulty level of the question and how the students attempt it. So I wish you good luck for the exam. And from our MedPrep Online, we will launch our preparatory course soon. And I wish you all to join that course. And we will be helpful. We will shortly, we will give our detail of the course. And meanwhile, you can join our free WhatsApp group. And we will help you in all the modules in our this free WhatsApp group.
Excuse me.
Yeah. Yeah, I can hear you. Hello.
Said
Hello.
what if we only listen to the lectures and revise them?
I think you should practice the books also, and the last 3 years recalls. That's very important.
I mean, reading the books is equally important.
Yes, yes, it's very, very important.
Okay.
They are very helpful. Yeah. Don't read all the
Can you
books. The
please
major.
tell?
Yeah.
I asked, like, if we are doing the past papers, and
Mhm.
can you tell us only one book of each, like Gynae and Ops, that we revise and we pass?
No,
No.
no,
Oh.
not a single book. Take at least 2 to 3 books.
Oh my God.
They
Okay.
are not so much lengthy. Believe me, you can do it.
Mhm.
They are very easy.
Okay.
Huh.
Okay.
Yeah. And just have a study partner. Okay. If you don't want to study books, at least take a course then. Take a paid course. They will help you.
Okay.
Yeah.
Okay.
And
Right.
make a buddy. Make a buddy who is also
Okay, sure.
at the same motivation level as you. Then definitely you will pass.
Okay. I think whole class.
Hello?
I said whole class must be in a better motivation level than I am.
You will find someone.
Definitely.
Yeah. You see, when I was preparing for my part 3, I found a friend from India, one from Bangladesh. We studied together.
Okay.
So it doesn't
That's
mean
good.
that you have, yeah, we study online and we just make a time schedule that when we would be available, we make a groups, means a WhatsApp group, and anyone who is available, they start discussing. Yeah.
Oh, that's good. Good
Yeah.
idea.
Yeah. You see, you can write your query in a group that you want a study partner, and if to entry you got someone, just make a WhatsApp group or Telegram group,
Yeah.
and then means if you 3 or you 2, you out of 3 or 4 people, 2 or out of 2 you have the same time, and you can manage your time together. So anyone, if out of 4, 2 or 3 are available, they can study together.
Yeah. Thank you so much.
Welcome. So this was all our presentation today about how to prepare for MRCOG Part 1. And I wish you all good luck. Get means ready and try to register for the book your exam, and then we will help you.
Okay, thank you.
Welcome. Thank you so much. Thank you all, and have a very nice day. Bye.
Right.
Jazakallah. Allah Hafiz.
Allah Hafiz. Bye.